Tak boleh.
Okay.
Yang ni dengar?
Boleh? Ya.
Okay. Tapi gambar tak ada.
You mute dululah.
Yes. Okay, you all may start now.
Okay. Hello, everyone. Good day to you, and thank you for joining our Facebook Live session with Gleneagles Hospital Penang. We really appreciate your time for joining us today. So, in conjunction of World Obesity Day, which is tomorrow, we are delighted to have representative from our bariatric team from Gleneagles Hospital Penang. We have 3 interesting topics to share with you all. And without further ado, let's welcome our first speaker, Dr. Vimal K Vasudeavan, our general surgeon, with the topic, what if I'm obese and is it a cosmetic issue? Welcome, Dr. Vimal. Hello, Dr. Vimal, you can start now.
Okay, sorry, yeah. Can you hear me now?
Okay, Dr.
Okay.
Vimal, you can start now.
Okay. Let me go back to my beginning. No matter how many webinar you do. Okay, so good afternoon or good evening, everyone. Facebook viewers, staff of Gleneagles, Mr. Kiru, for joining us today to welcome the impending World Obesity Day. So my name is Vimal. I'm a consultant general and minimally invasive surgeon at Gleneagles Hospital Penang. I'm also the president of the Endoscopic Society of Malaysia and the Malaysian Hernia Society. And also I am a representative from Malaysia, the Asian Endoscopic and Laparoscopic Surgeons Association. So my topic given to me today is to talk on what if I'm obese, not that I am, and is it a cosmetic issue? Okay, so before we go into the topic per se, I need to tell you something about obesity or overweight. The two are different things, but they are the same entity. You are normal, and then you become overweight, then you become obese, then you can become super obese. Okay, so it is defined as a medical condition. Okay, so medical condition means it's a disease. Okay, in which excess body fat has accumulated in the body to the extent that it can have a negative effect on health. So the catchword here is it's a medical condition defined by excess body fat, and it has a negative effect on health. Okay, so most of us, we know obesity, we calculate it by the BMI. That is your body mass index, which is your weight divided by height squared. This is how we calculate the BMI. Of course, there are many other parameters to detect obesity, but the most universally used, widely used is BMI. So we know from here it is a medical condition, not necessarily a cosmetic issue. Now, weight is graded according to what I said just now, your BMI into average weight, overweight, obese, and morbidly obese, depending on whether you're a Western or Asian. If you notice, the Asians are overweight or obese or morbidly obese at a lower BMI compared to the Western. This is because of the percentage of body fat inherent in the Asian population. We are obese at a lower BMI compared to the Westerners. Now, the second concept I must teach you, I must tell you, is the concept of what types of fat do we have. Subcutaneous fat is what we see under the skin. Okay, so subcutaneous. Cutaneous means skin. So fat under the skin is subcutaneous fat. Now, the visceral fat is the fat which is enveloping your organs, like your heart, your vessels, your kidney, your stomach, your intestine, all the organs, liver, and all that. Okay. So if you notice in the diagram, the lowest risk is when both are minimum. So you have lowest risk. But if you have a lot of subcutaneous fat, which is fat which is evident outside, then you have moderate risk for medical problems. Okay. If you have very high visceral fat as compared to subcutaneous fat, you have highest risk for medical problems like diabetes, hypertension, and all that. I'm sure our other speakers will elaborate more on that. So this concept is very important. When you're managing somebody with obesity, are you trying to manage the subcutaneous fat or you're trying to manage the visceral fat? To me and to Mr. Kiru and our team, multidisciplinary team for bariatric and obesity clinic, Gleneagles, our aim is to treat the visceral fat. Okay, because our aim is to treat patients or cure patients or help patients to control their medical illnesses, okay, like diabetes, hypertension, reduce risk of stroke and heart attack, improve their lifespan, okay. So this is our target. Why am I telling you all this? Because clearly visceral fat, which is deposited in your liver, kidney, gallbladder, colon, and all that, has a role to play in producing diseases of those organs, which I just mentioned, okay? So they can cause harm, okay? So, so visceral fat concept is very important. So if you are doing cosmetic procedure, we are not removing visceral fat. We are only removing subcutaneous fat, which doesn't affect the health. It affects look. Okay, so that's what. So if you look at the top 6 plastic surgeries done in the US in 2015, you will see those on the left-hand side are all the procedures. The most commonly asked question by patients to me when they see me in my clinic is, doctor, do you do liposuction? So liposuction deals with removal of subcutaneous fat, which has no bearing on your health. So we don't do liposuction. It is good for patients who have small collection of fat around the abdomen, the buttock, or the thigh, which they want to remove, not for people who are obese and who have medical problems, okay? So now, these are the issues which can complicate obesity. Okay, it can affect, it can cause hypertension, it can increase risk of stroke, cataracts, it can cause cardiovascular diseases, it can cause diabetes, okay, and non-alcoholic fatty liver disease. Okay, this is a liver disease caused by non-intake of alcohol. Those who don't take alcohol also can get fatty liver. Okay, so it's due to obesity. Gallbladder, gallstones are very common with the obese patients. Okay, a lot of gynecological abnormalities like infertility, okay, abnormality in their menstrual cycles, polycystic ovarian syndrome. These are common. There are about 30 to 50 cancers blamed on related to obesity. Okay, so and then we come down to the joints. We have many patients who are obese who are referred to us for obesity treatment because patients have gone to them with osteoarthritis requiring change of the joints, either the hip or the knee. So these are the medical complications of obesity, and all these are related to the visceral fat, not the subcutaneous fat. Okay, of course, the joint one is more due to the weight. All right. So when this is clear evidence that obesity is not a cosmetic problem. Okay, it is more of a metabolic problem. It is more of a clinical problem, and it is defined as a disease by World Health Organization, WHO. Okay, why do we need obesity management in Malaysia? Because we are the fattest country in the Southeast of Asia. Okay, you look at the population chart around the region, we are number one. This is in 2011. Now we are 51-52% obese or overweight, far ahead of our neighbors. Okay, this also shows, if you see between male and female, no definite difference. Okay, they are equally high, but the female has a slightly more obesity and overweightness. Okay. Now, how does obesity affect the country? You see, this is how much the country is spending to take care of obesity-related diseases, which I mentioned to you in my earlier slide, right? So our healthcare spending on obesity-related issues far outnumbers our neighbors, okay? So there's a clear urgency in needing to tackle obesity. It is not a cosmetic problem per se. It is a real medical issue, same as the current pandemic affecting the world right now. Okay, now, so that is my slide. So to end it, what if I'm obese? What will happen? You will have a shorter lifespan. You will die earlier. I'm telling you the hard facts. You are at risk of developing medical and surgical illnesses, including cancers. Okay, you will lose many working days due to medical reasons. The taking of medical leave is higher among obese compared to the non-obese. Okay, because of that, employers are very shy to employ people who are obese. So their unemployment is higher than normal individual. You see, so that's what happens if you're obese. You can develop many diseases. Socially, you may be affected. Economically, you may be affected. Okay, and then after that, you die earlier. So is it a cosmetic issue? A big fat no. Thank you very much. I'll stop sharing. Thank you.
All right. Okay, thank you, Mr. Vimal. So now we would like to call upon our second speaker, Mr. Kirubakaran, our breast endocrine and bariatric surgeon, on his topic, okay, I need to lose weight, but how? Let's welcome Mr. Kirubakaran.
Yes, thank you very much, Ms. Yasmin, for the very kind introduction. Good evening, everybody. I know it's after a heavy day at work, but it's really an honor to be here with you all to share a topic that we hold very close to us, and just now Mr. Vimal has given it a very well presented regarding the problems of obesity in Malaysia. And now I will share with you the options that we have if you are interested to lose weight and how you can actually do so. So before we begin, ladies and gentlemen, I would like you all to ask a question to yourself. When you need a solution, where do you find these options? Who do you listen to? What are the factors that will influence your choice? A lot of people will feel that you have to be very motivated for you to lose weight. Is that enough? And most importantly, is weight affecting your health? And are you very clear on all the choices that you have available? So a lot of people will embark in their weight loss journey without answering these questions to the maximum and finding the answers before they actually start. Now, if you look at the solutions for weight loss, there's a lot of options out there. If you look over the internet, WhatsApp, banners, and even products that kononnya can pecah lemak and you can lose about 10 kilos in 16 days. So these are some very outrageous claims that we hear. But the great news is that there is help available, but you just need to know how to find it. And always the first step is always very difficult and very hard, but if we persist, we can. And there are a lot of people who have done it, and we have to congratulate them. No matter how they did it, they have lost the weight and they have gained better control of their health. So my first consideration for y'all is that, do you want to lose weight or do you want to be healthy? It's two different things. You can lose weight to become healthy, but losing weight alone does not make you healthy, because if you do it very fast, a crash diet and so on, you may lose weight, but you may not be healthy overall. So we emphasize a change in your lifestyle behavior and something that is more long lasting for you to have the benefits. Second thing is that motivation alone is not enough. You have to be very clear. Like if you can see this triangle here, this pyramid, how you're going to do it, that is very important. And that's where you need experts to guide you, to show you, and to maintain that weight loss regime in a long duration, not just lose weight today, and then after a few months, again, you put on the weight. The third thing is that, as you know, there are some beauty operators who have done some processes that have gone tragically wrong, and some people have actually passed away because of that as well. So be very clear. Anything that you find that is, too good to be true, too cheap, may not give you the value that you want and may affect your health, especially when you're using products, slimming products and so on. So be careful in your choices. The next thing I would like to say is that the science behind obesity is very complex. Like Mr. Vimal has said earlier, there are a lot of factors that can induce a person to actually put on weight and to stay there. So we think that weight loss is very easy. If you just restrict your diet, you cut your calories and you exercise more, you will lose weight. But the truth is that you need more emphasis in the different types of choices that you have to maintain that weight loss and the solutions. If you look at this slide here, you have your lifestyle approach, which of course is your calorie counting, checking your meals, having a good, well-balanced workout and so on. You have diet counseling with our dietitian, meal replacements, non-exercise activity thermogenesis, whereby you actually walk to work or you actually park your car someplace in a distance and then you travel by walking, extra effort in doing your household work, chores and so on. Physiotherapy, behavioral therapy, medication, of course, we have that available. And of course, surgical solutions where myself and Mr. Vimal as surgeons, we deploy the intragastric balloon, which is a space-filling device. I will share with you in more detail. And of course, bariatric surgery. So as you can see in this slide here, 1 in 2 Malaysians are obese. So we need something that can go across to all the different spectrums of patients and in the different categories of obesity that we see in Malaysia. Now, what happens when you lose weight? Your weight is not going to keep quiet and allow you to stay where you are. The normal metabolic response will be when you cut down your calories, as you can see here in the picture here on the left-hand side, when your calories come down, when your activity goes up, the body will find a way to try to pull you back. And this is by reducing your metabolism, trying to conserve energy, increasing the hunger hormone, which is called ghrelin. There are other hormones that also take an effect, like GLP-1, peptide YY, different types of hormones, numerous hormones, and they will try to induce you to make you feel, try to make you feel more hungry and also decrease your feeling of fullness so that you will eat more. So this tussle of this tug of war will happen to all of us at every point of our life. And we have to understand that, okay? So here in Gleneagles, we have a weight management team where we do it in a multidisciplinary approach, where we have experts, dietitians, surgeons, physicians, and we have every other modality, orthopedic surgeons, ENT surgeons, cardiologists, and so on. So if you need someone who has a problem affecting any of your system, then we can help you out that way. And focused weight experts, myself, Mr. Vimal, our dietitians, our psychologists, psychiatrists, we can help you. It's just that we need to formulate a plan for you, and you have to make the decisive step to want to be able to lose weight. So here's a very simple diagram for you to follow. Make an appointment with us. We go through your history, your assessment, and we consult with our experts, whoever that you need to. We give you a definitive plan for you to follow, and you proceed with the journey. So the videos are available in our website, as well as our Facebook page, Penang Weight Loss, as well as in our YouTube channel, Penang Weight Loss Clinic and Surgery, as well as in our Gleneagles Penang website. So as you can see here, in graphic representation, this is what I mean. You as the patient will be in the center, and you will be treated holistically by all our experts around. So you have the best treatment option for your particular condition that you are facing. So lifestyle packages that we have, of course, including nutrition, weight loss. We even have our partnerships with certain gyms where we can actually send you and make it available. Medications, we have several types of medication that's available, but primarily right now, the most fanciful medication we have is called Saxenda or liraglutide. It's a once-a-day injectable weight loss solution. Now we come to the Ellipse gastric balloon, which is the new kid on the block. We launched it last year. We were the first center in the Asia Pacific region to actually place the Ellipse balloon. And how it works is very simple. You have a capsule, as you can see in the palm. It fits in the palm of your hand. You just swallow it in our fluoroscopic center, which is in our X-ray department. We confirm that the capsule is in the stomach. It actually gets filled up with water, a special solution. And you can see in the palm of the hand below, this is how the balloon looks like. Exactly after 4 months, the balloon deteriorates and it passes off naturally, as what you can see in the right-hand column in the picture. Now, the balloon offers an option for patients who want to jumpstart their weight loss treatment. They have failed other modalities of treatment, and they need something as a bridge for them to enable fertility treatment or to go for knee replacement surgery, or even if they do not qualify for any surgical option. This is an example of some patients who have undergone the Ellipse placement, of course, over a short period of time. So we always encourage our patients to continue the lifestyle change once the balloon is out, so that they may be able to sustain it for the long term. This is a gentleman who actually lost more than 20 kilos after putting in the Ellipse balloon last year. Now, I will just share briefly about bariatric surgery. So bariatrics is a study in the treatment of obesity. It does not only mean surgery, okay? It means the whole armamentarium that we have. It's the most efficacious and the most lasting treatment for those who are morbidly obese. That means their BMI is more than 40. And of course, certain types of surgery, which is called metabolic surgery, is recommended for patients who have type 2 diabetes or metabolic conditions in these obese patients. Now, I will share with you the indication for bariatric surgery. So according to our national guidelines, which will be published in this month, ironically, coinciding with the World Obesity Day, which is taking place tomorrow, 4th of March, we find that patients who are obese, BMI greater than 37 or more than 32 with significant comorbid like diabetes, hypertension, sleep apnea, and so on, are candidates to undergo bariatric surgery. Of course, you have to be in the age group of between 18 to 65, and you have to actually fulfill the either criteria that is listed here. All our bariatric procedures are done laparoscopically. That means mostly we do with 4 or 5 small holes, which we use a camera to go in, and we do the several different types of bariatric procedures or surgeries. Now, the most common right now will be the sleeve gastrectomy, which is cutting the stomach in a shape of a banana. So I will just be very brief in view of time constraints. As you can see, you will still be able to eat, but you are eating lesser in amount, and it also has hormonal changes that result in a lasting condition whereby you do not feel hungry after the surgery. And all these procedures are done using titanium staplers, which are permanent and they do not form any effects or any side effects in terms of bleeding or in terms of having any leaks and so on. So the complications rates have dropped drastically in the last 5 to 6 years. Now you can see this is another gold standard procedure for bariatric surgery, which is called the gastric bypass, where the stomach actually is joined to the small intestine. So this is a more powerful surgery for you to actually lose weight for those who have diabetes, hypertension, and other medical conditions. If you can see in this diagram, most of the conditions, medical conditions that are related to obesity can be improved with a 70 to 90% resolution of their complications. Here we have some pictures of patients who have undergone surgery, and this gentleman here has lost 80 kilos after bariatric surgery over a period of a year. And most of our patients will actually do well. And most of patients actually have to have a good follow-up where they are seen after 3 months, 6 months, and then a year later. So we have to make sure that the safety profile is fulfilled and patients undergo procedures that is targeted for them and individually. So as you can see, most of the patients are satisfied with their weight loss. So this is our final patient, Puan Amelina, who will share with us her journey later today. So with that, I would like to just end this by saying that your journey to good health begins with your decision. You have to start. If you feel like it's time for you to lose weight, to gain control of your health, then please make that choice, make that decision, and you can reach out to experts like us to help you. Thank you very much, and hope to have a good day. This is our contact. Please contact us if you have any questions. Thank you very much.
All right. Thank you so much, Mr. Kiru. So now let us welcome our dietitian, Miss Ivy Cheah, to share about eating to lose weight healthily. Welcome, Ivy.
All right. I have to share my screen here. Give me a second. It's not sharing it. Why is my screen not sharing?
Can you just share screen?
Yeah, but tells me I need. Maybe Hazel, you can share for me. Yeah.
Okay, Ivy, can start now.
All right. Okay, so I'm Ivy, dietitian in Gleneagles Hospital, and we work closely with both Dr. Vimal and Dr. Kiru to help patients who have come to us for weight loss. Yeah, next slide. So the ultimate goal, as Dr. Kiru and Dr. Vimal talked through, the ultimate goal for us to lose weight is, of course, health in the end. Therefore, we want to make sure that we are losing weight healthily. Yeah, next. So what do we mean by losing weight healthily? Of course, we want to lose more fats than muscle for one. That is why when you come to see any of us, the body composition will be done. We will see how much fats and muscles you have. And when you come for your follow-up, we want to also track those so that we know whether you're eating well enough, or if you are not having enough nutrition, or you're just losing water instead of real weight. So that's why sometimes in certain diets and with certain supplements, people tend to lose weight very quickly, especially in the beginning. And when you actually do measure their body composition, they did not lose fat or muscles, they were losing water, which is redundant, because once you consume back that water, your weight comes back to normal. That is why it shoots up also very quickly, especially for certain diets. The other thing also, we want to make sure that we are eating well in order to get all the nutrition that we require. And lastly, also not forgetting our mental health, our focus and energy. We do not want to eat too little that we cannot work. We do not want to eat, we do not want to also restrict too greatly that it affects us mentally. All right, next. So therefore, when looking at the bigger picture, we want to lose weight, but we want to lose weight healthily. Next. It is a journey. It is not a 1 week diet. It is not one surgery and then that's it. My weight will come down. It is a long-term process because we do not want short-term results. We want long-term results, right? So therefore, generally it comes in these 3 stages. In the beginning, it will be more of the active weight loss, and after with whichever modalities or methods that you have chosen and discussed with our surgeons, then after that we will transition and lastly go for weight maintenance, which is also a very important point in this weight loss journey. Next. The consistency, therefore, in our daily habits is very important in our diet, physical activity, and our lifestyle, which is how much sleep you're getting. Like Dr. Kiru shared earlier, it is not only how much you are eating and how much you're exercising, it's also your sleep, your stress management, and a lot of other things that comes into play. And I would emphasize on consistency and daily habits. It's not a one-day diet. It's not a one-day solution. All right, next. So small choices becomes action, and actions becomes habits. Habits becomes our way of life. So this is what I like to emphasize to all my patients. We want to make sustainable changes in our diet, things that we can maintain and sustain for long term, because we are looking for long-term management, not short-term. We do not want things that are too drastic that we're only able to practice for a few days and then after that you give up before you even see any results. So that's redundant again. Therefore, it's the small choices that you make every day, in every meal, in every hour of your day where you're spending your energy. If that becomes a habit, and after some time, you will find that you don't actually need to think about what you're eating, for example, because you have been practicing what was taught to you, what was right, eating well. And in the beginning, yes, you have to determine, okay, this is my carbs, this is my protein, but after some time, it becomes a habit. It comes naturally and easily. All right, okay, next. Next slide, please. So like also we talked about the causes of obesity. There are many reasons and causes of it, as you can see here next. And therefore, this calls for the multidisciplinary team. Next slide, please. Weight management is not an easy task. That's why we are here. That is why you do not only see a single person to help you with the weight loss. You might need the psychologist or the physiotherapist or myself, the dietitian, including the doctors. Yeah, that is also coincides with this year's Obesity Day. Obesity Day tagline, which is everybody needs everybody. Because of the many reasons and causes of obesity. Yeah, that is why you need a team to help with weight management. And sometimes it is not your fault. Next slide, please. So what if you decided to go for surgery or the ellipse balloon placement? Next. Before the surgery, there will be a preparation, meaning before the surgery, there will be 2 weeks before the surgery. We will put you on a very low calorie diet, which is less than 800 calories, with the aim of reducing liver size and visceral fat, which what Dr. Vimal has shared earlier. Yeah, This is to enhance and to improve surgical outcome. Yeah, generally it is with meal replacement to ensure nutrient adequacy. Because like I said earlier, we want to lose weight. Even in this stage, you will lose some weight, but we need to make sure that you are getting sufficient nutrition. It is a high protein and low carbohydrate diet and must be done with medical supervision. Next. So in general, what happens is that, of course, with surgery, your stomach size is reduced, like Dr. Kiru shared earlier. Regularly, you might be able to take 2 to 4 liters of food and beverages at a time, but after surgery, only maybe 1 to 2 cups. Same with the ellipse. What happens is that the ellipse balloon itself displaces some place in your stomach and therefore reduces the amount that you'll be able to take in. All right, but in the end of the day, remember, it is also that we are eating less, that we are losing weight. Next. And after surgery, there will be a diet transition, which moves from the clear fluid to the liquids, blended, soft, and regular texture. Next. It takes about 1 to 2 weeks of each. Next slide. So in the clear fluids diet, you'll be next. You'll be able to take things like anything that is see-through. Keep on pressing, Hazel. Teas, green tea, ginger tea, black tea. You'll be able to take coconut water. Hazel, next, please. More. Yeah, resource, which is one of the supplements that we will start you on, especially on the first day, together with barley, anything that is clear, okay? This will take sometimes only 1 to 2 days. Next, then we'll move you on to the liquid diet, which is all kinds of liquid, of course, including those in the clear fluid stage earlier. This will generally include meal replacements, simply because of the nutrient requirement that we won't be able to achieve much with regular food, such as also plain yogurt, milk in tea, soy milk, smoothies, soups, even creamy soups, but without chunks. So all these in the liquid stage. Next, we'll move on to the blended or the puree diet. Think of it as if you need to eat without chewing, okay? Things like porridge, blended a little bit, oats, mashed potatoes, tofu fa with less sugar, blended pumpkin and carrots, things like that, or soft fruits like bananas, anything that you can use your fork to mash on. All right, this is the puree diet. Then you move on to the soft diet. For example, earlier the porridge, now you don't need to blend it anymore. You can have it regularly. Soft rice and fish, poached fish, idli, yeah, idli and dal, milk, spices, soft boiled eggs. So all these are in your soft diet. So blended, these diets will take 1 to 2 weeks in general, depending on individual tolerance. Then we move on to the regular textured diet, which is everything else, but focusing, like I said earlier, prioritize on nutrient density, making sure that you are getting sufficient nutrition. Next. Now, after that, of course, you will still be only taking small volumes. It doesn't mean that after that diet transition, you'll be able to eat like usual in bariatric surgery. Yeah, you'll be able to take smaller volumes, which is in sips and spoonfuls. The regular meals will be according to your new stomach capacity. So even when you wanted to eat more, you won't be able to. So these small meals, because we're eating less, we need to make sure that these small meals contain all your nutrients that you require throughout the day, especially proteins, which should be prioritized throughout the whole process. Also sufficient hydration and nutrition, hydration especially, because you won't be able to gulp down a glass of water as usual already. So therefore, these, like I mentioned earlier, have to be made into habits that you carry on throughout the whole journey of weight loss to weight maintenance. Next. Next, please. So bariatric surgery changes the amount you can eat. Yeah. Next. But it does not change what you decide to eat. I always say bariatric surgery helps you to control how much you can eat, but it doesn't tell you what you can eat this and you cannot eat that. It is still up to you. So in the end, it is still the decisions that you will be making. You will be deciding what to put on your plate and into your body. Yeah, which is also important because there are also people who can put on weight even after surgery if they do not watch what they eat. Okay, so that's why you will see us regularly to remind you on these things. Next. So take the opportunity after bariatric surgery or even with the ellipse. The ellipse also comes with the transition diet phase, but it's a shorter period of time. Yeah, take it as an opportunity to practice and build healthy eating habits, such as mindful eating, recognizing when to stop, and selecting healthful food on your plates. Yeah, lifestyle changes is still necessary. Yeah, meaning taking control of your exercise, your stress management, your sleep, sufficient hydration. All these changes are still necessary even after bariatric surgery. Next. So like I mentioned earlier, consistency. With bariatric surgery, intragastric balloon, Saxenda medication, or even just regular diet, consistency is still very important. Imagine this analogy, a tissue paper roll, you know, your toilet roll. Now, when I watch my diet and do my exercise for one day, I take a piece of that tissue roll. The second day I do it again, I take one more piece. Do I see changes in the girth? Not yet. But if I keep on going, the more days I'm consistent and I remove more, then you see your tissue paper roll get smaller. But in 1-2 days, you won't see any difference. That is why consistency very important. All right. Okay, next. So just a final reminder that small actions becomes habit and actions becomes small choices becomes action and actions becomes habits and habits become a way of life regardless whichever modality that you choose. Diet, exercise, and lifestyle changes is still very important. All right. Okay, so that is all from me. Thank you very much for your attention.
All right, thank you so much, Ivy, for your sharing. So now, finally, we have our special invited guest for today. She's one of the patients who have went through the bariatric surgery, and let's listen to her experiences. Okay, meanwhile, if you have any questions, you can feel free to drop your questions to us. And let's welcome Miss Hidayah to share your experience on bariatric journey. Welcome, Hidayah.
Hai, terima kasih menjemput saya dalam session live FB ni.
Okay, Hidayah. Hidayah, maybe you can share with us your experience and your preparation on your bariatric journey.
Okey, saya share sikit lah pada pengalaman saya. Sebelum ni saya ada masalah sikit dengan masalah untuk kesukaran saya nak tidur, masalah berat badan saya berlebihan ni menyebabkan saya ada diabetik tahap 1 dan saya mula ada masalah dengan sakit lutut. Setiap kali stres asyik nak makan kan. Alhamdulillah, tapi selepas saya dah buat operation ni, so gula saya pun kembali ke paras normal dan tak perlu lagi dah dengan ubat-ubatan ni semua. Dan untuk masalah yang lain tu alhamdulillah semuanya kembali pada normal. Okay, pada yang saya dah buat preparation sebelum operation ni, saya dah start minum susu yang telah ditetapkan oleh dietitian saya dalam on very low calorie diet, dan saya pun mengikuti program yang telah ditetapkan oleh tim bariatric tu, iaitu program exercise, pergi gym dan lain-lain jugalah. Kenapa? Okay.
Ada lagi yang Cik Hidayah nak share with us? Cik Hidayah? Okay, while waiting for Cik Hidayah, whoever interested to join our package, you're entitled to receive the free BMI measuring tape and also 1 sachet Optifast diet drink. Okay? All right, you can see now our image here. Why wait to lose the weight? So we have 3 tests: bariatric special consultation, dietitian's consultation, and also BMI test only at 200 ringgit, and also a free BMI measuring tape. Okay? All right, while waiting for another sharing by Miss Hidayah, we have few questions for our doctors and a dietitian. We go through with dietitian first, Miss Ivy. Okay, the questions is from our reader and viewers and audience. What is the option for the post-op surgery? Can you share, Ivy? Ivy, you're on mute.
Okay, all right. So the post-op option is just like what I shared earlier. It will go through a period of transition to allow your stomach to recover and adapt again. So it will come from clear fluid to your all kinds of fluids, puree, soft and regular. So you imagine it's just like babies when they're young, they start with milk. After that, makan kanji, they have all the puree, very soft food, right? After that, they can eat regular soft food like porridge and all that. And then followed by regular rice. So it's the same thing post-op, but the duration depends on individuals' condition and tolerance to them. But in all these stages, the priority is still in nutrition adequacy, especially for protein intake. Yeah.
Okay, thank you, Ivy. Okay, another question is maybe to Dr. Vimal or Mr. Kiru to answer. Okay, there's a questions from our audience. What financial options do their patients have to perform the bariatric surgery?
Yeah, can you all hear me?
Yes, we can hear you.
Yes. So, okay, that's thank you for the question. It's a very nice question. So I think now the problem with bariatric surgery in the private sector is because of the cost. So sometimes the cost varies from place to place, but roughly it's anywhere between 30,000 to about 40,000 ringgit. So of course you are able to pay for it cash if you can. A lot of people would like to use their insurance. Unfortunately, bariatric surgery, as Mr. Vimal had said earlier, it's not been propagated as a chronic disease yet in Malaysia wholly. So that's why the coverage for bariatric surgery by most insurance companies, they're not providing it. Okay, so the options that you have is quite limited. So if currently to help patients, KWSP EPF withdrawal for account 2 is allowed for bariatric surgery. Okay, you can use your account 2 to withdraw the whole amount, and you can use that to fund that for your bariatric surgical procedure. You can apply for financial loan, what we call as fintech, from certain bank institutions. They allow that with a very attractive percentage, what they call it, interest rates. So this is another option you can take. And of course, you can also approach your Koperasi, Angkasa, and all the different available financial institutions, including Baitul Mal, Zakat, and so on, and make approval for your bariatric surgical procedure. And if you need any help in doing so, we can actually direct you to a finance accounts division to actually help you in making the necessary choices. Yeah. I hope that answers the question.
Yes, thank you so much, Dr. Kiru. Okay, Dr. Kiru, maybe you can share a bit on our package here.
Yes. So according to I think Gleneagles, they have come out with a very competitive, very interesting package as well for patients to actually consult and to make that first step, like we have shared earlier, and as Ivy has elucidated. So tomorrow is actually our World Obesity Day, and the theme is theme that everybody needs everybody. So I think that's where we all should come together to help individuals who are having problems related to obesity, their health, and take that first step. So since we have a lot of options, since we have a lot of direction, Ivy also has mentioned a lot of dietary approaches that we have. So we need to assess you all individually and come up with a plan and a package treatment option for you. So I think please make use of this current offer that we have, and I think it's fairly very well worth it as well for you to actually check your your medical conditions, your eating behaviors, habits, patterns, and so on. And of course, to do your BMI test to see what is your overall fat composition and so on, and put you on a tailored plan. And from this consultation, maybe you will actually find the solution that is most best for you. So I think, Yasmin, my take-home message to everybody is that take that first step, and then let's see what happens after that.
Thank you so much, Mr. Kiru, for your sharing. Okay, there's another question from our audience to Miss Ivy. Okay, why is it after exercising, I feel more hungry? Maybe you can share a bit of your explanation.
Okay, thank you for that question. Interesting, yeah. It's good to know that you are exercising. To the person who is asking this question, to the viewer who is asking this question, congratulations. Yes, so exercising, it really depends, all right? What do I mean is that, first of all, the timing of your exercise. If you are exercising 4 or 5 hours after your meal, of course you feel like hungry. It is very natural for you to feel hungry 4 or 5 hours after a meal, okay? Now, so one is the timing. If say you just had your meal, two to 3 o'clock your exercise, you shouldn't feel hungry lah. But if you do, it could also mean that you might not be eating enough. All right, so number one is your timing of your meal and exercise. Secondly, how much and what you are eating. All these will affect how long your food is able to sustain. Yeah. Food, for example, like proteins and carbohydrates together with your vegetables in a whole meal, what we call a complete meal. Yeah. It will take 4 to 5 hours to digest. Okay. So in that 4 to 5 hours, should be able to not feel hungry, so to speak. If you do, you might not be eating enough, or you might not be having enough fibers, for example, not enough vegetables in your meal. That's why you feel hungry quickly. Or it's just simply the overall quantity is too little. Yeah. So maybe there can be a lot of reasons to it. Okay. But I hope these two considerations might be the answer to your hunger after exercise.
Thank you, Ivy, for the answers. Okay, for another last questions to Dr. Mr. Kiru or Mr. Vimal, we received one question. What is the complication or side effects of the bariatric procedure?
I think Mr. Vimal can take that question, maybe.
Yes.
You take lah. I will talk about the finances part.
Yeah, I think the finance covered already, Mr. Vimal, just now.
Oh, is it? Okay. You do lah, Kiru. I am out of flow a bit.
Okay. Okay. So, Yasmin, the question was on the.
The question is on the complication or side effects of the bariatric.
Okay. So, as we all know, in life and any surgery also, there's always some form of a complication that we always we like to inform all our patients, because in medical terms, we are very direct and we are 100%, we try to control the whole situation. Like for example, Yasmin, if we are taking a drive from Penang to Kuala Lumpur, we never think about the weather, we never think about the, our tire, engine, the highway, how's the situation, whether anyone is going to come into our lane and so on. But when we're doing surgery, we are very, very particular in, one, the patient's condition. Second thing is the operating area, the OT, the instruments that we use, the devices, the operating surgeons, the anesthetists, and all this has a bearing on the outcome. So that's why our complication rates are very, very low, because we take a lot of preparation in choosing the patients, making sure that, the correct procedure is, that we choose for the patient is exactly what the patient needs. And we take precautions in every step of the way. But having said that, even in the best of hands, you will have a complication rate of less than 0.1%. Currently, this is the worldwide percentage of complications acceptable for bariatric surgery. Of course, these are in high volume centers with very well-trained surgeons who have a lot of experience in bariatric surgery, like myself and Mr. Vimal. In hands who do not do bariatric surgery very often, that means they do maybe less number of cases in a year, then the percentage of complication rates and everything should be higher than expected. So the take-home message is that there is no such thing as absolutely no complication. There is always something available, but if they do happen, then you want your team to be able to handle the situation as it arises. So rather than planning, 100% that nothing will happen, of course that is what we are going for. But if it does happen, then you want a team, or you want a surgical team that can handle the problems that do occur. When we're talking about surgical complications, they're divided into general complications, which is complications that affects the whole body, your lungs. You can have pneumonia, you can have pulmonary embolism, you can have heart attack. If it affects your cardiovascular system, you can develop thrombosis, that is blood clots in your blood vessels and so on. And complications can be targeted to the procedure specific. That means in operations, like I mentioned earlier, sleeve gastrectomy, you can have complications like bleeding, you can have narrowing of the sleeve tube like stricture, you can have a situation where the sleeve part of it actually ruptures or it causes a leak. So all these complications can happen. It's described in our textbooks and so on. But like I said, in the good hands, the complication rates are very low, and we minimize it by the surgical technique that we are quite used to. So these are in short or in brief, to go through the whole situation. All our patients who come to us have to undergo a very, very clear, long discussion about all the pros and cons of bariatric surgery. And based on that findings and a very mutual understanding with all our patients and everything, they sign what you call as a consent form, whereby you agreed and you understand regarding the whole surgical procedure. And we take our time by doing this as well. We don't like to cut short by telling, oh, you just sign on the dotted line and we can proceed. No, you have to be very clear on what is going on. And I think that's what most bariatric surgeons will do nowadays. Thank you.
Okay. Can I add on to that?
Thank you so much. Yes, please, Mr. Vimal.
Okay, so Mr. Kiru has walked you through all the possible complications and all that. I will talk or tell about how to prevent these complications from a patient's perspective. So most studies have shown complications are definitely a part of surgery. Luckily for us, the complication rates as described by Mr. Kiru is extremely low, but they are still a problem. How do we prevent it? One, as a patient, you must choose your center. You must choose a center which has a multidisciplinary team, because studies have shown patients who are operated or procedure done at a place with a multidisciplinary team, the success rate and the risk of complications are lower. Okay, so choose a place which has a multidisciplinary team. Do not choose a place where there's only a single person running the whole show. That is a recipe for disaster. We have read in the newspaper people dying of procedures. Okay, so number one is that. Number two, your surgeon's experience counts. Now, the experience of the surgeon in number of years and number of procedures done over the years and number of procedures done per year is absolutely important in the outcome of patient. So patient have a right to ask the surgeon, doctor, how long have you done this surgery? How many have you done? And for how many do you do every year? And what are the complications you have? Is all well and good describing complications which are in the book. But in this day and age, patients have a right to know from the surgeon's mouth what complications he has had and what has he done to treat these complications. That is very important. Okay, so combine Mr. Kiru and me, we have almost 23 to 25 years of experience. And then we are surrounded by a multidisciplinary team. So with that, we can say that our complication rates are low. And if and when we do have them, most of them are minor complication. And even the major one, we can handle them well because we have good team around us. Yeah, that's my take. Thank you.
All right, thank you so much, Dr. Vimal and Dr. Kiru. Sorry for the connection problem earlier. So we'll welcome back Ms. Hidayah to share her experience on the bariatric journey program.
Terima kasih Yasmin.
Hello,
Okay.
Hidayah.
Hai. Okay, saya kongsi sikit lah pengalaman saya sebelum operation tu. Saya mengalami masalah sakit lutut, susah untuk nak saya solat. Lepas tu saya ada masalah dengan kesukaran untuk nak tidur malam lah. Biasalah bila badan dah berat badan berlebihan ni, rasanya macam lebih ke arah snoring sikit lah. And then dan saya pun kuat makan jugalah masa tu. Dan bila dah terlampau obses sangat dengan makanan, bila satu masa tu saya tergerak hati untuk nak check lah paras gula saya semua. Dan doktor dah sahkan saya ada diabetik tahap 1 lah. Dan lepas tu baru saya buat keputusan untuk nak buat pembedahan bariatrik ni. Dan Alhamdulillah selepas pembedahan tu, paras gula saya pun dalam kembali ke arah normal. Dan tak perlu dah untuk saya nak ambil ubat-ubatan ni semua. Dan untuk masalah kesukaran untuk nak tidur malam tu berkurangan. Tak adalah saya kata 100% tu tak ada langsung. So berkurangan dah. Dan sakit-sakit lutut ni memang dah tak ada dah, Alhamdulillah. Sebab lebih banyak ke arah exercise, pergi gym. So ada aktiviti yang sihat dengan family, dengan friends semualah. Okay, untuk preparation sebelum operation tu memang saya dah start on VLCD diet, very low calorie diet, di mana saya diprovidekan oleh dietitian untuk minum susu. And then saya mengikuti program weight loss ni dengan team bariatrik. So kita adakan dengan exercise. So pergi gym, aktiviti yang sihat lah yang saya lalui ni. Alhamdulillah.
Okay, Ms. Hidayah,
Yep.
congrats for your achievement. So what exercise are you doing after the surgery? Jenis-jenis exercise yang Cik Hidayah buat? And when have you started?
Okay, selepas operation tu saya cuma buat exercise yang ringan dululah, tak ada yang ke arah berat sebab apa nak kena tunggu keadaan saya pulih seperti sedia kala. So saya cuma berjalan untuk yang ringan-ringan sahaja. Dan bila doktor dah kata luka saya semakin sembuh dan saya boleh buat ke arah yang berat sedikit, maksud saya jangan terukkan lagi keadaan tu lah. So saya dah mula start pergi gym. Yang tu je lah.
Okay, maybe, okay, Ms. Hidayah, maybe you can share why you choose Gleneagles as your option and maybe a sedikit tips on why on the bariatric surgery.
Okay. Based on my survey tu, saya pilih Gleneagles Penang ni sebab ada tim bariatrik yang lengkap. So, saya rasa confident lah untuk nak buat pembedahan ni. Bila soalan yang saya ajukan tu memang mendapat keyakinan untuk diri saya. Dan pada sesiapa yang ada cadangan untuk nak buat pembedahan bariatrik yang dalam keraguan, silalah berjumpa dengan pakar untuk membuat pilihan yang lebih baik untuk diri anda.
Alright, thank you so much for your sharing, Ms. Hidayah.
Can I ask a question to Puan?
Yes, please, Mr. Kiru.
Puan Nur, tanya, ramai saya rasa penonton hari ini bertanya-tanya tentang memang ke benar sehari selepas pembedahan tu memang boleh berdiri, boleh berjalan dan bergerak-gerak macam biasa?
Ya, boleh bangun, boleh berjalan seperti biasa. Yang penting mindset kita. Kalau kita nak ke arah yang lebih sihat, do it. Bukan sakit, nak duduk, nak kena tangguh lama-lama ke atau apa. Bangun, berjalan. Tanamkan sikap positif dalam diri, insyaAllah semua okey. Betul.
Because macam hari ni pun kita ada pesakit yang datang pun tanya yang soalan yang sama. betul ke doktor ni boleh jalan hari yang pertama? Saya ingat lepas pembedahan mereka melakukan pembedahan macam pembedahan lain semua memang terlantar mungkin sehari dua. So that's why terfikir pula ini bariatric, sangat besar pembedahan dia. So mungkin saya akan duduk di hospital seminggu.
Sebab kalau you nak buat perubahan yang besar dalam diri you, patut ada semangat dalam diri you. Saya rasa lepas satu hari, not to say that 24 hours lepas operation tu, lepas beberapa jam tu you dah rasa diri you okay dan kuat, you dah boleh berjalan dah. Dan ini pada pengalaman saya lah.
Betul.
Actually,
yes, Mr. Vimal.
Actually pembedahan ni taklah besar sangat, taklah muskil sangat. Okay, kebanyakan surgeon boleh buat. Tapi untuk dapat result yang bagus, keputusan yang bagus dengan patient yang betul, kita kena rancangan dengan betul dengan patient, bincang dan buat pembedahan yang selamat, dan the outcome, quality pembedahan semua akan baik. You know, so semua orang boleh buat, tapi bila ada team yang lengkap macam ini, keputusan lebih baik.
Ya. Saya rasa yang lagi satu, Puan Nur, yang untuk ikut dengan VLCD diet, very low calorie diet, maybe kita tanya dengan Miss Ivy. Ivy, what is VLCD diet actually?
Hi, yes, VLCD, like I mentioned earlier, it's a very low calorie diet, less than 800 calories, kurang daripada 800. And because it's very low in calories, we need to make sure the nutrition is at maximum. Okay, the main aim is to reduce visceral fat. Yeah, the fat surrounding the organs, especially in the abdominal areas. That is why this VLCD will be for patients who will be undergoing bariatric surgeries 2 weeks at least before the surgery, in order to get the best outcome of the surgery. Like, everybody has been concerned about complications and all that. So part of the patient's role in enhancing the outcome of the surgery is to be good with your VLCD. Yeah, Hidayah was very good with her VLCD.
Yeah. Puan Hidayah, okay ke? Ada masalah ke untuk ikut dengan diet plan yang disarankan semua? VLCD diet, post-op semua? Okay ke?
Okay, tak ada masalah untuk tu. Cuma regime dietitian yang dah ditetapkan oleh dietitian tu, cuma kuantiti yang sikit saja untuk saya makan. Kadang-kadang tu macam tak boleh nak makan dah untuk step yang seterusnya. So saya lebih banyakkan minum air dan pergi gym. Macam tu je kehidupan saya sekarang. Tapi alhamdulillah semuanya okey.
That's why saya rasa kalau kita nak plan rancangan untuk bariatric macam ini, kita haruslah ada satu dietitian yang sangat bagus dan hebat yang boleh memberikan makanan kita tailor kepada apa yang kita suka dengan kenikmatan kita, targeted lah. It's individualized atau personalized untuk kita sendiri, bukan untuk you pergi minum ini susu dan makan ini dan semua orang bagi satu risalah dan hantar mereka balik.
Alright, okay. Mr. Kiro, Mr. Vimal, we have another last question. Okay, after bariatric surgery, how long to wait before trying to get pregnant? How long do we need to wait before trying to get pregnant?
Okay, yeah, thank you. I think it's a good question as well, because you know why? Once you do bariatric surgery, you are going to lose weight. So your body is actually altering, it's actually changing, you know. So let's say you are doing surgery, let's say we choose a number, 100 kilos. So when you do bariatric surgery, when your weight is 100 kilos, your BMI is, let's say 35, or let's say your BMI is 40, okay? Now, as you lose weight, it is going to use your visceral fat, it's going to use it's going to break down your body fat and tissue and so on. And you will, your metabolism also slows down a bit. So you got to exercise, and then that picks up your metabolism. And then as you lose weight, you find that you become more lighter, your comorbid, everything improves and so on. Now, during this period of change of the body, you also are going to experience some hormonal changes. So that's why you find those women who have polycystic ovarian disease or fertility issues and all that, you find after a weight loss of about 5 to 10% already, you find your fertility issues will already start improving. You also find your PCOS pain after menses also will start coming down, your menstrual will start becoming a bit regular as well. But the whole process of weight loss does not stop until 1 year to almost 14 months after surgery. Sometimes it can go a bit longer, but on average, mostly 1 year to 1.5 years. So that's why we as bariatric surgeons, will advise patients, if you're becoming pregnant, please, choose some, for those married women, choose some barrier contraception or some form of contraception to prevent yourself from accidentally becoming pregnant. Because if you become pregnant when you're losing weight, what happens is your baby may be of low birth weight. You might have, problems during your pregnancy, intrauterine growth retardation and so on. So we don't want that. We want you to have a good, successful pregnancy. So it's best to delay it. But having said that, we have had situations where patients have become pregnant within that first year of undergoing their surgery. And most of these patients will be able to deliver well as well. But you need to be followed up by your gynecologist and us as your bariatric surgeons more closely, because we need to make sure that you do not undergo malnutrition. We have to monitor your baby to make sure the growth progress and everything is according to schedule, and you are able to deliver either normally or by cesarean section, depending on the your gynecologist. Yeah.
Okay, in addition to that, can I add?
Yeah, please.
Okay, so I think there will be somebody keying in who has had a gastric band before or has done bariatric surgery before. So those days when we were doing gastric band for weight loss, we used to advise when they become pregnant, we need to deflate the balloon on the band. So that advice is still holds good now. So if you have a gastric band, if you're pregnant, you have to release the balloon until after your pregnancy and the breastfeeding and all that, then you can re-inflate. Of course, nowadays, most surgeons have stopped doing the gastric band, but still we may have on and off patients who have had one done before. So if there are anybody who has had a band done before, you need to deflate the balloon when you become pregnant.
All right. Thank you, Dr. Vimal and Dr. Kiru. We are talking about VLCD diet drink. We are also giving a free sachet of VLCD diet drink for those who are signed up with us with this package. You are entitled to receive this free BMI measuring tape and also the VLCD diet drink. Okay. Another last question. So sorry. Another questions from the viewers. Can I do gallbladder surgery or hernia surgery together with the bariatric surgery?
Yeah, Mr. Vimal, maybe you take that question.
Yeah. Okay. So combination of surgery. This we see quite often because, as you know, obesity predisposes to gallbladder stones as well as hernia. Now, the decision whether to do together is controversial. It differs among surgeon to surgeon. No two surgeons will have the same opinion. I will tell you my opinion. The studies and the outcome studies are inconclusive. Okay, so sometimes we do the ideal thing is to do the bariatric surgery first, then get patient to lose weight. Okay, now if patient has obesity and gallstone, if you do together, you say you're doing obesity surgery, it has its own complications, okay, risks. Then you do gallbladder surgery as well. Then the risk of the complication from the gallbladder surgery is in addition to the risk of complication from obesity surgery. So some surgeons are okay with that. Some surgeons are not okay with that. So how do I decide? Now, if the gallbladder, not all gallbladder with stones, we need to remove. It's only patients who have gallbladder stones which are causing symptoms or have undergone complications which need to be removed. So when you have a patient with obesity, with gallstone, the question I ask myself is, does the gallbladder need to come out? Means infection or symptom. Then if it needs to come out, I will do together with the obesity surgery. Okay. If the gallbladder doesn't need to come out, I won't do it. I don't routinely do removal of gallbladder because I don't want to increase the risk for my patient. But some surgeons do. Okay. Now, if you have obesity surgery with hernia, what do you do? So many studies have shown the results of hernia surgery in patients with obesity is not very good, means the recurrence rates are high. So when you have obese patient, the priority is to reduce the obesity. Then you repair the hernia. Okay, so this is one reason. So that the success of both surgery will be independent. Okay, so you don't go and combine. This is what I think. But there are some surgeons who do both hernia repair as well as obesity surgery. I also have done it. But the risk is, if one is a clean surgery, hernia, one more is you are cutting the intestine, doing suturing, anastomosis and all. So when you open the intestine, doing anastomosis and repairing and all, you are exposing the bacteria into the environment of the abdomen. Now you go and put a clean mesh there, there's a possibility the hernia mesh can get infected. If it does, then it becomes a disaster. If it doesn't, you are a hero. So that's why it is a very controversial topic. So we always look at pros and cons. There is no correct answer. What do you think, Hiro?
Yeah, I totally agree, Mr. Vimal, because I think, as you rightly said, it has to be individualized. If the patient is symptomatic for the gallbladder cholecystitis and anything like that, then of course it warrants to be taken out. We don't routinely take out the gallbladder when there's no stones or as a prophylactic mechanism. Totally agree. Hernia surgery depends on the condition of the patient as well. But I do think maybe if patient has inguinal hernia, maybe at the same time, probably we can tackle the bariatric surgery together with inguinal hernia. But I think for ventral hernia, what you said is rightly so. I think we follow the same, we're on the same track actually. Yeah.
All right. Thank you so much, Dr. Kiru, Dr. Vimal, Miss Ivy, and Miss Hidayah, and all viewers and audience for joining us on Facebook Live today. See you next time with more interesting topics. And thank you and have a good evening, everyone.
Thank you, everyone.
Bye-bye.
All right. Thank
Bye.
you.
Bye.